Hi, I'm Dr. Ketan Badani. I'm the director of the Comprehensive Kidney Cancer Center here at Mount Sinai.
Great. So today we want to talk about the kidney cancer. So the first question is, can kidney cancer be detected early?
Well, the problem with kidney cancer is that there is not a screening test. And so the way kidney cancer is detected is through imaging, CAT scans, ultrasounds, usually for another reason. So one of the things we're working on is developing a screening test for kidney cancer, but one does not exist right now.
Great. What are the symptoms and signs of kidney cancer?
Most kidney cancers are silent. So most kidney cancers are diagnosed what we call incidentally or by accident when you're imaging for something else. But there are some signs and symptoms that if you have these, you should see a urologist. Blood in the urine is a very important one. Flank pain, pain around the side, the bottom part of your ribs, which is another one. And of course, if you have a strong family history, it's always good to have that looked at.
And what are kidney cancer risk factors?
Yeah, I mean, the risk factors for kidney cancer are wildly unknown. What we do know is that most kidney cancers are sporadic, which means somebody gets them without any particular predisposition, and then they're cured from it, thankfully, and they don't ever get another one. But the risk factors we do know about are one, family history. This is a very genetic type of cancer. Smoking, obesity, have also been implicated in kidney cancer.
Great. So next we want to talk about kidney cancer diagnosis. So what tests do you conduct to determine a kidney cancer diagnosis?
The most common situation where a kidney cancer is diagnosed is from some type of an imaging test. So you go into the emergency room because your belly hurts, or you see your primary doctor because you have some pain or discomfort, and you get an ultrasound or a CAT scan, which is very common, and sometimes even an MRI, and they find something on your kidney. And then that's when you have to clue in to get more specific testing. But it's really all imaging based.
And what questions should I ask my physician after I've been diagnosed with kidney cancer?
Right. Well, a couple things. One, the type of doctor that treats and specializes in kidney cancer is either a urologist that specializes in the treatment of kidney cancer, or a medical oncologist that specializes in the treatment of metastatic or kidney cancer that has spread. Now, thankfully, most kidney cancer is diagnosed early. It's diagnosed confined and contained. And so when treated, and treatment usually is synonymous with removal, it's cured by doing that. But that is a discussion you should have with a urologist.
Great. So moving on, we want to talk about the treatment options of kidney cancer. So can kidney cancer be cured? What are the treatment options for kidney cancer?
Sure. So the first question, can kidney cancer be cured? Yes. By and large, the majority of kidney cancer is curative. It actually is one of the most curative cancers, solid organ tumors of the human body. Now, the problem with kidney cancer is that it's really good for a long period of time. And so the window of cure is very long. But once kidney cancer spreads, once it leaves the kidney, it goes from one of the best to one of the worst, because a lot of our traditional therapies don't work on metastatic kidney cancer. But thankfully, most kidney cancer is diagnosed early and so can be cured. The second part of your question was the treatment options. And so for an early diagnosed kidney cancer, one that looks like it's confined to the kidney and hasn't spread, the most common treatment and the most effective treatment is to remove the tumor. And that can be done in two ways. You can remove the whole kidney with the tumor, and that's called a radical nephrectomy. Or you can remove just the tumor, and that's called a partial nephrectomy. And the goal of that is to remove the cancerous part, the tumor, but save the normal part of the kidney so it can continue to contribute kidney function throughout your life. Now, people can live with one kidney. So if you had to remove a kidney for a kidney cancer, it's okay. Your day-to-day life should not change in most situations. But if something were to happen to that one kidney, then you don't have that second kidney as a backup. So we do try our best to do partial nephrectomy whenever it's reasonable to do that. If you're not a candidate for surgery because of medical conditions or comorbidities, or the tumor is very small and early, you can do an ablation, which is where you can heat or freeze to destroy the tumor. And that has been gaining in popularity. And then the last option, which is a very important option, is if it is small and it is very early, most of these kidney cancers that are found this early on an imaging test grow very slowly, and they behave in a very, what we call, indolent way. They don't spread quickly. And so there's something called active surveillance, where you can watch these tumors and determine the ones that need to be treated over time and the ones that can continue to be watched. And so that is also part of the discussion when you talk about treatment options.
Great. Lastly, is there anything else about kidney cancer that's important for people to know right now?
Well, I think there's a lot of important things about kidney cancer. Even though it's not one of the most common cancers you hear about on TV or the radio, like prostate cancer is, or breast cancer, lung cancer, it is a top 10 cancer in both men and women. And so as we continue to image more frequently, do CAT scans more frequently, we are diagnosing these kidney cancers more commonly now than we were before. And it's always important to remember there are specialists who really devote their time and their effort to treating the disease of kidney cancer. And so we have one of the largest kidney cancer programs in the country devoted to the treatment of this disease. And so, you know, it's not something to be afraid of. It's not something to be scared of, because ultimately the outcome for most patients with kidney cancer is very good. People do very well, but definitely you have to see a specialist when it comes to this particular disease.